So very good evening to one and all present here today for the webinar on managing, biomedical waste in the context of COVID-19 and beyond. We, MedPiper Technologies, based out in Bangalore, we are a medical technology organization working on to bring out a global knowledge graph of medical professionals, data, governments, and helping organizations to enable better and faster healthcare outcomes. Today, we have our expert speaker, Mr. Farid Uddin Said, sir, a professional in hospital planning and quality management and practitioner of TQM Kaizen, as well as a well conversant with the hospital accreditation processes. He is also a certified external assessor for National Quality Assurance Standards (NQAS) in public hospitals by the Government of India, Ministry of Health and Family Welfare, and have eminent experience of preparing health facilities of NABH accreditation as well. Also, national trainer on biomedical waste management with Bureau of Indian Standards (BIS). Thank you so much, sir, for agreeing for today's webinar. Over to you, sir.
You're welcome. Thank you, Soumya. Good afternoon, everybody. Biomedical waste is a subject which has been in discussions since 1998, and even before when the HIV/AIDS started in 1970, late 1970s. The discussion started from there, and the Government of India then acted after consultations with international organizations, WHO and many other organizations, environmental specialists, and then we finally framed out our own guidelines and rules for managing biomedical waste in India. Now, 1998, July 27, the actual biomedical waste started. Management rules were there, but even today, like we are in 2021, 23 years now, still I keep on going for giving trainings. Of course, it's an ongoing process. The learning process is always there, but it's a sad state that in our country, thanks to COVID now, that biomedical waste is given that kind of importance which actually needs to be given. As I always say, we need academia to get involved, or the health and the officials and the people who are in the environment sector should involve the academia to get through some research papers, some researches on as to how much actual problem, how big is the problem for us. And if it is not, then we should not worry about it. But if it is there, we have some data from WHO, we have some data from international organizations, some small PhDs or some papers, small one or two papers are there, one or two PhDs, a few PhDs, not one or two. I don't have the numbers, but then yes, few papers have been published on this. People are working in different places, but there's the joint effort still needs to be more strengthened. But that's what I've been feeling. That's what I've seen. That's what my experience is throughout my journey on the biomedical waste, which I started long back in 2005 when I started with working with the Japanese project. Now, coming back to the topic, biomedical waste. I'll not take much time now. I'll start sharing the my PowerPoint, the presentation, and I hope it's okay. Soumya, which we start this screen sharing.
Sure, sir. Sure.
Presentation. Yeah. So. this is today's webinar. The title is Managing Biomedical Waste in the Context of COVID-19 and Beyond. So the definition, as we all know, is so any waste which is generated during the diagnosis, treatment, and immunization of human beings or human beings or animals, or in research activities pertaining thereto, or in the production or testing of biologicals. This is what the general definition is. But uh, if with the COVID-19 in existence, we are more frequently using these terms, like the used PPEs such as masks, triple layer, N95, gloves, examination, nitrile and latex gloves, then shoe covers, splash-proof apron, hazmat shoes, used plastic goggles, and face shield, etc. Uh, Surprisingly and noticeably, we we could not see many other surgeries getting performed during this period, and many other hospital activities were already at a hold during this time. But yes, the COVID-19 was playing havoc all over the country, all over the world, and that's what those terms were in more of use. These frequently these terms were very much used, and we all know earlier PPE we used to educate people what PPE is. Now even the children at home, they understand what PPE is. So this is what I'm talking about. I'm sure when we are working with the health sector, we all know all these things. But uh, before, there's use of PPE in the hospitals was not that uh, religiously done. So now it is being followed. That is what is another take home point from the COVID-19, that yes, please do use your PPEs when in hospital. So some pictures of biomedical waste, some expired or spoiled medicines, used injections, syringes, needles, uh, then used IV sets and tubings, body parts, placenta, etc. And then some waste which is spread out within the hospital campus, outside the hospital campus, outside in the gardens, parks. Very uh, frequently, these pictures are available in every corner of the city. Many times we could see after so much of hue and cry about this waste, we still could see. Probably those people who are managing or who are asked to uh, clear these kind of waste, they are not very much trained. With the current trend of housekeeping staff being on contractual basis, we see many people getting changed every day. Today, though, that out of the 20 people coming in for housekeeping today will not be the same tomorrow. Out of them, maybe 5 to 10 people will be new faces. So those, again, I would say there should be a uh, thumb rule that whoever is coming in for the housekeeping contract through the contractual agencies should have a proper training on biomedical waste if they are working on in the hospital. So this is a picture in one of the scrap vendor shop in a small town in some state, which I took. We can even see some needles being put in this. See, this can spread infection very easily. We do not disinfect these bottles, rather we just give them, sell them out. Though there are rules how to dispose them off. There is a treatment option also, we'll see the later slides. But this is one of the uh, alarming pictures which I found somewhere while traveling, and I had to note of it. I took this picture and even went to the administration of that city, and some action was taken. So, but this is still happening. So, what are the responsibilities of the waste people? The segregation of waste at source. Those people who are the generators of biomedical waste, uh, like the institutions where the hospitals where the waste is generated. So the segregation of waste at source of generation is very important. Uh, we see needles in the syringes, and the syringes kept in trays and for being disposed of later when the safai karmi or the housekeeping staff comes, and the sweeper or the ward boy will come and take it. The doctor will leave it for the sister to do, sister will leave it for the ayah to do, ayah will leave it for the sweeper to do. So it goes on like that. The packing of waste is another important responsibility as per the color coding with labels and tags. Storage, keeping waste at a pre-decided place in its premises. Storage means we keep the waste in one particular area, in a closed area, marked with the, I'll show you the pictures later on, uh, marked with the biomedical waste and a hazard symbol put onto it. And there will be different areas, separate areas for storing different color code wastes. So this is how, from where this area, the storage room or whatever you call it, the place should be in such an area, such location where the incinerator wala's vehicle will come directly there and pick the bags and the boxes and take it from there directly. So it doesn't have to uh, cross the hospital and disrupt the traffic and other. So it should be located in such an area where this uh, waste can be directly taken easily from the that place outside to the incinerator. So we all know we have to have okay. If let us talk on that also. Authorization. The next point is coming. Taking required authorization. Authorization is through the state pollution control board. Authorization for generating, handling, and treatment of wastes, and also disposing in some cases. So this is you apply as per number of beds. There is some fees to be charged by the pollution control board, which you have to pay, and then the authorization. Their inspectors will come inspect things there as per your application, and then they give you the authorization. In many cases, they just allow the authorizations without even visiting them. Then there is a facility operator. Uh, in all the places, most of the places, we have incinerators which has, as per the guidelines, up to 10,000 beds, there should not be more than one incinerator. So this is the norms as per but looking into the geographical area, the state can take a call on that. The state pollution control board can take a call on that. And number of facilities, the incinerator facilities can be increased as per the PCB, their authority. So after that, we also have installation of barcoding system in the premises and encode the barcode to all packed BMW bags. So there are different colored bags and boxes, and then there should be a barcoding onto that. So this is what it is. The facility operator payment is separate. The authorization fee is separate. The authorization fee goes to the pollution control board, the state pollution control board, and the facility operator, which is also be contracted for taking the waste, and they also charge some fee per bed per day according to the rates as per the rates in that particular state. that has been fixed. Many states are still struggling to come up with the proper rates onto that. So this is what happened. Okay. So as per this WHO definition, out of the total waste generated in a hospital, only 15 to 20% is infectious and further bifurcated infectious waste. And 80 to 85% is general waste, which is non-infectious. So we can say, by and large, there are just two kind of waste being generated in the hospitals: infectious and non-infectious. Infectious waste will have further categories, non-infectious waste will have different categories. So this is how it happens. Now, non-infectious waste is 80 to 85%. But if it is not taken care of in proper time, then it also generates infections. So just imagine if a banana peel is left outside in the floors of the hospital or in the corridor or even outside in the garden, the bacteria will start coming onto it, and after some time. So it has to be discarded properly. So this is and disposed properly. And after 2014, we have seen especially there have been guidelines for it. For the solid municipal waste, guidelines are there, and we can see blue and green boxes all over the city, and the hospitals should also should go in for the blue and green boxes for that. Now, infectious waste, which is 15 to 20%, which we have to take care of. This waste has been given some color coding for segregation by the Pollution Control Board. 1998, as I was saying, there were 10 categories when it started. Now, after there was a lot of confusion. There were categories of waste: the sharps, the anatomical waste, and the plastics, and chemicals, and medicine, and liquid waste, and many other things. There were different things which were like, and they were going into different color code bins. The color coded bins were yellow, green, blue, not green, yellow, red, blue, and white. Blue or white were either same, and then there was black also. Now there were confusions. Which waste, which category of waste should go into which color? So the government took cognizance of it, and then we came up with 2016. We came up with the new set of rules, wherein all those 10 categories and the four colored of the colors where the of bins were then categorized like that. The waste categories were given to the colors only. So in yellow, there is one category of waste, yellow category. What all waste will go into yellow? This is very clearly written. Then there is red, then there is blue, and the fourth one is white. There is no black now. So black, many places, many hospitals, I could still see black colored bins being used for general waste, which is again incorrect, which should not be done. So these are the four categories: yellow color. What all will go into this? The human anatomical waste, animal anatomical waste, solid waste. Now we also have how it should be stored, how it should be collected, where it should be collected. So there should be a plastic bin, a container, plastic container of yellow color, and the same colored bag, which is non-chlorinated. So which should be non-chlorinated. That means it has to directly go into the incinerator. So it has to be without any chlorine content in it. So non-chlorinated bags. So these are the items going into it. You can see human tissues, then the body parts for anatomical waste, which we are talking about. Then solid waste like blood, body fluids like dress. all the items contaminated with blood and body fluids like dressings, plaster casts, cotton swabs, and bags containing residual and discarded blood and blood components. So we have chemical liquid waste, which chemical residue is there, so which that will also go into that. And discarded linen mattresses, of course, they have to be mutilated before being discarded. Then microbiology and biotechnological and other clinical laboratory waste that also should go into it. Important thing here is blood bags. Blood bags which are still um, plastic bags, which should go into yellow only. Here, take this note. We'll talk on this later on also. The options for storing, you can see center, yellow colored non-chlorinated plastic bags. And in the last column, the third column, we have the disposal options. You can see incineration or plasma pyrolysis, deep burial. There is no treatment. There is no treatment for this. Just important thing to be noted. There is no treatment for this. All this waste coming into yellow category will go directly either to the incinerator or the deep burial. These are important things to be noted. Then plasma pyrolysis is one new technology. A couple of years only it has come in India also, but still a long way to go. This is a new technology and a bit expensive one. So there's still there are many experiments going on for this, but we have right now we have incineration for all this disposal of yellow colored waste. So this is important. We should remember all these kinds of waste, including the blood bags. Now, second category, if we talk, that is red color. Red category. Red category will have all the recyclable waste. The contaminated recyclable waste, what are those in the hospitals? They are the tubings, the IV bottles, and then IV tubes and sets, IV sets and tubing sets, and then catheters, urine bags, syringes without needles, and fixed needle syringes, the vacutainers with their needle cuts, and of course gloves, the rubber gloves also, and the plastic gloves also. These are going into the red container, which again container will have red colored plastic bags, non-chlorinated plastic bags. Now, the only thing which is allowed in the plastic bags here, there are two colored bags. See now, yellow and the red one. Both are non-chlorinated plastic bags. The treatment options from the hospital, if you have to send it out to the incinerator people, it is autoclaving, microwaving, or hydroclaving. No chemical treatment, no chemical disinfection. If at all you are disinfecting the plastic, the recyclable waste from in the hospital, please do not disinfect it with chemicals. No chemical treatment should be done. If at all you're doing it, it is autoclaving, microwaving, and hydroclaving. Though it is being allowed by the pollution control board, state pollution control boards, that all the material, the plastic waste in the red category can go without doing the rules we have that it should be treated like this, but state pollution control boards are allowing, but because the incinerator people, they are doing the disinfection there. And the important thing which the hospital should take note and should follow is shredding or mutilation. Now shredding, there is a shredding machine which shreds the plastic into very small pieces, which cannot be reused and can only go for recycling. Now, another option is mutilation. mutilation can be done. Shredding cannot be bought. The shredder machine is like only one that can be put in the hospital, and then a person will have to be assigned for it. So it is better we have scissors, the big ones, the tailor scissors or a big one scissors, so which should be kept at every nursing station where the waste is, or every point where the waste is being generated, and uh, and that scissor should not be used for cutting the anything else other than the waste material. So that the bottles and the tubings, they all should be mutilated. Why this is done? This is done to avoid any kind of reuse of these bottles. Like I showed you that picture, which was in the scrap vendor's shop. Um, they were being sold. And there have been instances where the bottles were refilled and came out in the market. Refilled with what? If some people who are playing with the lives can do anything, they can put stickers of any company and labels of any company and bring it out in the market, just filling in plain water. And that plain water may also be infected, may not be very sanitized water. So it is better we mutilate the bottles also, we mutilate the tubings also, so that they are not repacked and reused. So to avoid that, mutilation or shredding is allowed, and it's in the guidelines, and it should be as per rules. It should be done. Now, this plastic, if given to the recycler, like the incinerator people will have a large number of, because they are uh, managing 10,000 beds. So those that kind of plastic material which they have, and after shredding, they can send it to the authorized recyclers for energy recovery or plastics, so diesel fuel or any of road making, which whatever is required. So this plastic waste also should not be sent to landfill sites. This is also important. There is a note on it by the Pollution Control Board. Next category is waste sharp. Waste sharp, including metals. Now, what is sharp here? This is metallic sharps in white color, translucent. Needles, syringes with fixed needles, needles from needle tip cutters or burners, scalpels, blades, or any other contaminated sharp object that may cause puncture and cuts. That is all metallic, not glass. Glass can also be sharp, but I'm talking about this. This particular category only talks about metallic sharps. This includes both used, discarded, and contaminated metal sharps. The containers used here are puncture-proof, leak-proof, tamper-proof containers. It has to be white in color, translucent, so you can see how much it is filled inside. Then it also should have a, and all these yellow also, red also, all these bags as well as the containers should have a biohazard symbol for anyone to see and avoid going close to it. So only authorized persons can touch it or use it. Otherwise, the people will be putting general waste also onto it. So there should be clearly written instructions that uh, this is only for biomedical waste, and it should not be and it should not be uh, uh, used for throwing the general waste. Now, after the treatment in option, treatment option here also is not chemical treatment. Autoclaving or dry heat sterilization, again followed by shredding or mutilation or encapsulation. So shredding and mutilation, we are not doing it here. We can send it to the incinerator people. When we have the contract with them, they will take it, and uh, they will further uh, send it to the final disposal to iron foundries. So you are not to take care of it. You just have to send it to the incinerator people. The fourth color, the fourth category of waste is blue color. If we don't find blue colored, here also you see cardboard box were allowed earlier. There, this was initial 2016, that is why I have not changed it. But there were rules, there were amendments in 2018 and 19, whereas where cardboard boxes were changed to waterproof, leak-proof, and puncture-proof boxes. So cardboard boxes cannot be leak-proof. We have to change that to after the 2018 and 19, where the amendments came in after this 2016 rules. So this was the amendment for it. So the cardboard boxes are there. Now, this category will have glassware. Earlier we had metallic sharps. Here it is broken or discarded and contaminated glass, including medicine vials and ampules, except those contaminated with cytotoxic waste. Now, this glassware, it is either broken or a complete full bottle. Once it is empty, it should go into the blue colored box, the blue colored container, not the cardboard box, which is after the amendment. Initially 2016 rules said but cardboard boxes, but now it has been changed. It should not continue. Another category which they have put in here is metallic body implants. You see earlier metallic sharps were there. Here the body implants are going into this category. So as per the rules, we have to follow that, and this should go, all these things, this kind of category will contain these kind of wastes. So they are all going and being collected into blue colored, puncture proof, leak proof, and uh, tamper proof boxes. And for and the disinfection here in glassware is allowed. Chemical disinfection will be allowed here. So either with any agent or detergent or sodium hypochlorite treatment is allowed here. So autoclaving, microwaving, hydroclaving are also other options. And then they should be sent for recycling. Recycling, it should be either directly, which is very difficult to for every hospital to connect with those people. So it is better to give it to and it is being taken by the incinerator people also. So they take all the four categories, let them take it. Now, what we could note from here is yellow had plastic bags in the containers, red has plastic bags in the containers, and then white and blue, these are boxes. So they are not, there is no plastic bag into it. So only two color plastic bags will be there. Non-chlorinated plastic bags for red and yellow categories. White and blue category, they are puncture leak-proof boxes. Please take note of it. Now, disposal option, we are sending it to the incinerators. Another, for small remote area of hospitals where this common treatment facility vehicle is not able to go due to access problem or due to viability problem. If it is going especially 50 kilometers just for a 6-bedded hospital, waste to be collected from there, it will not be feasible for and the rates will not be afforded by the 6-bedded hospital also. It will be a unnecessary burden on that hospital to give higher rates to them. So they will not be sending their vehicle, the treatment facility, the common biomedical waste treatment facilities, which are the incinerator facilities. So in such cases, very reluctantly though, but the Pollution Control Board has this option, and they allow in these such areas a deep burial. pit. Deep burial pit is can be made available within the hospital campus, but there should not be any water body, and there are so many ifs and buts. But so we need to understand, and we need to talk to the Pollution Control Board directors before getting a deep burial pit made in our hospital, whether it is allowed there or not. If the common treatment facility vehicle is coming, then you'll have to go with that only. You cannot have a deep burial pit for that. So this is important in that we should take care of these things. Now, COVID-19, what happened in COVID-19 and what is going to continue till we are out of it? See, COVID-19 biomedical waste is generated in the hospital. Biomedical waste is generated in the hospital, we all know. Some cases, yes, home treatments are there. So there also that waste is generated, but there has been always a question mark and a concern by the authorities on the waste being generated, but it's not in a very high quantity. So it's not been looked into that intensity right now, but it will be looked into very fast. But with COVID-19 coming in, they were all concerned with the home quarantines also. So we have various areas where this waste was generated. The COVID hospitals, the dedicated COVID hospitals. Then the dedicated hospital care facilities there where the quarantines are there. Then fever clinics were there, where people were coming in for their treatment and their testing, the sample collection centers also, the vaccination centers also. So these are the places where, and the quarantine center, DCHC is the quarantine centers which many college hostels were converted into, many hotels were converted into, and the home quarantine centers were also included in the DCHC. DCH is dedicated COVID hospital, and then these DCHC are the COVID health centers are there. Only these quarantine cases were kept. Those were positive cases, but without many symptoms or without severe symptoms. They were not there. So these people were under quarantine into these places. So what are, again, these four categories are there. The same categories continued, but especially in because there were in large numbers. So as per this final slide I have come up with as per the last guidelines which came into August 2020 by the CPCB. This is according to that, and the following slides will also be according to that. These are the four categories which I'm talking about. The guidelines talk about yellow bin with non-chlorinated bags, double layer. They said double non-chlorinated because the infection was fast spreading. So double layer, double chlorinated, 2 bags in one container. Cloth masks, linen, then PPEs like triple layer masks, N95 masks, head cover, shoe cover, non-plastic apron or semi-plastic coveralls, then swab sticks, used tissue paper, cotton, handkerchiefs, used toiletries, bandages, plastic casts, blood bags, apron pad, and diaper, etc., contaminated with blood fluids. All those things were going into yellow colored bin with non-fluorinated bags. The bags will be double layered. Same in the red bin with non-fluorinated, again double layered, but these items will go into it. The recyclable plastic, rubber PPEs such as hazmat suit, then latex and nitrile gloves, plastic vials, viral transport media, then Eppendorf tubes, containers, plastic trowel, pipette tips, then syringes, tubings, catheter, etc., to be disposed after pre-treatment. That is autoclaving. Only after autoclaving, but normally these bags were also going without any treatment, and the incinerator people, they were taking pains and they were taking the responsibility of doing all the treatments before disposing them off. So these two categories with bags, the other two categories, blue, puncture proof, leak proof, temper proof box, glass waste such as contaminated box, broken glasses, medicine vial, ampoules, empty medicine bottles, and used slides, etc. Then white, puncture proof, leak proof, temper proof box, which is, of course, we can call it a plastic box, the big one, and sharp metallic waste such as needles, scalpel blades, etc. Here, one important point is many places we don't find a blue colored plastic box to contain this, to collect this glassware. What we can do is we can have a white colored box, which we are getting in the market available easily. So on that, either we can put a tape, blue colored tape, or we can get it painted on one single layer blue colored. So it will serve the purpose. But we should have the uh, the biohazard sign on that. That is important. Biohazard sign on all these four categories. So these were in during the COVID-19. These are the specially focused biomedical waste which was generated, and the guidelines and the rules were coming out of CPCB one by one from March to August. They came out with 4 revised versions of their guidelines, and final guideline which was uh, given out in August 2020. As per that, this particular slide is made, and the further slides coming after this are all based on these colors. Now, the hospital generated biomedical waste in COVID-19 context ensure that there are following notes to be taken in. Ensure that the biomedical waste generated during the treatment of COVID-19 patient is collected in separate yellow uh, plastic bags, and yellow and red colored bags with non-chlorinated plastic bags, and white and blue colored puncture proof and temper proof leak proof boxes with clearly marked COVID-19, as I already told, biohazard symbol on them. Ensure the segregated waste is stored in separate area in a dedicated collection room and handed over to the CBWTF vehicle. When they are coming to the hospitals for collecting the biomedical waste, general patients would be there. Of course, very serious patients were there, but non-serious patients were not coming to the hospitals in fear of uh, getting the COVID-19 infection within the hospital campus. So they were not coming in. Then ensure that the non-fluorinated plastic bags are used in double layer in yellow and red bins from the COVID-19 isolation wards. And there is no need for bags in blue and white boxes, as I already told you. So this particular point, which is I have highlighted and bold, that is ensure that the biomedical waste from COVID-19 and isolation wards is transported in a separate trolley marked COVID-19 and biohazard symbol to the dedicated collection room. The dedicated collection room will also have a dedicated corner for this COVID-19. Ensure the dedicated trolley, bins, containers are disinfected with 1 or 2% sodium hypochlorite solution daily. In the health facilities located in remote areas from where CBWTF vehicle doesn't go for collection of the yellow, red in the medical waste, the yellow category waste should be disposed of in the deep burial pit, which is as per the earlier rules also is there. I'll show you some pictures where the special marking on biomedical waste bins and the trolleys and the storage room for COVID-19 waste. Especially marked, these were the pictures from hospitals, various hospitals. Most of them have done, initially didn't, but this rule came in March 19 only. April only, but then a rule came in March, but they started working on it from April. This is a picture taken in April somewhere when I went to the hospital inspection during the COVID pandemic. So this is there. You see clearly marked trolley, the bins, and the dedicated room with clearly written COVID-19 biomedical waste. So this is still on, and we should continue with this till such time where we are told that we can do away with it. So as per the rules, we have to keep on working on this. Now, this is the internal transportation. Uh, that also was internal transportation. These are for smaller hospitals where intramural, the transportation is of two kinds, intramural and extramural. So external and internal. Internal, it should be made sure that the internal transportation of waste is not done in open and within the from close to the patient care areas. It should be from the corridors outside the wards. So this should be very clear message for all. Now, for home quarantine centers, see, home quarantines or hotels and the hostels where the biomedical waste will be generated. Definitely, the people are using masks and all those things. So the segregated COVID waste, as per the guidelines, as per the CPCB guidelines, just please note, segregated COVID-19 biomedical waste to be handed over to the waste collection agency specified by the municipal corporations and municipalities, which I'm afraid was very seldom done. Very few municipal corporations and municipalities took note of it, and their people were also not trained. Their people were trained to collect home waste, the solid general waste from home, houses, house to house collections. They've been going in, but they were not properly trained, and there were problems, and the spread of infection probably was. This was also one of the big reason for it. COVID-19 biomedical waste to be segregated in non-fluorinated plastic, double layered, and provided by the urban local bodies to the vehicle owners who are collecting these. The masks and the gloves used by all the persons at home to be stored in paper bags by any person. If even if you're not infected, the you the infection is in the air, So the gloves and the mask should be kept in the stored in a paper bag separately for 72 hours. After which they can be, because generally it is known that within 72 hours, after 72 hours, the infection will go away by itself. So it has to be uh, stored somewhere for that particular time, number of hours. So after which the same can be disposed of general waste as general waste. The mask and the gloves should be cut in pieces before disposal to ensure that they are not reused. This is important because you see, we can see on roadside open masks on the cycle walas, they are openly selling it, open masks without any plastic cover, without being packed, nothing. They're just open and they're in the people are buying it and using it, which is not correct. And those masks, you never know if you have worn it for a few hours and then thrown it like that without cutting it, without mutilating it, it may be subjected to reuse of, and this infection might spread. So we please make it a point then whenever you are throwing a mask or a glove, if you're using, just cut it before throwing it, so it cannot be reused. Then the ULBs will also be this for all the responsibility of the ULBs, the urban local bodies or the municipalities or the panchayats. They were to be doing all this. Their responsibilities included all these. The ULBs were also responsible to provide the yellow colored non-chlorinated bags where there are COVID-19 confirmed suspected cases. So we know there were red zones and orange zones and so many things, and home quarantines were there. There were board put up in the colonies, in the houses, in the flats. So all those things were there. So where will those people get the yellow bags? So the ULBs were responsible to provide the yellow colored non-fluorinated bags to collect those there waste material which was generated, like we have spoken already, the gloves and the masks especially. Then ULBs will ensure uh, separate team of door-to-door safe collection and disposal of biomedical waste, quarantine camps, quarantine centers, quarantine camps, home quarantine, and home care people. So this was also, I'm afraid, was not done, but we should see to it that this is properly done. If any ULB officials are there, please ensure. Um, and the message should be taken to them, because this is as per the CPCB guideline from the Environment Ministry, Government of India. So these are to be done by the ULBs, which I'm afraid even in my city, Bhopal, I could not see it being done. They were to engage the incinerator people. They engaged them somehow to collect it from some points, but up to those points, all the waste was mixed. So then the biomedical waste was not properly collected and even disposed of. So the spread of infection is one. This can add to one of the reasons to that also. The staff deployed by the ULBs for the collection and disposal of COVID-19 biomedical waste should be provided proper training as per the rules to use the PPEs and sanitization, which uh, still continues and should be carried on till the next guidelines, if they are doing away with it. Oh, okay. Outpatient department. Now, you see, we have many places where in the hospital where there are different kinds of risks. I have just tried to work out some places. This is a chart which I have made, a matrix. The help desk registration counter is there, where the activity provided to provide the information to the patients. The risk factor is mild. The type of PPE recommended is triple layer and latex, and the remark is physical distancing to be followed at all times. Doctor's chambers, again, mild risk, but these things should be recommended PPE, and the precautions should be taken. Then chamber of dental and ENT doctors and ophthalmology doctors, where it is very closely examining the patients. So clinical management is again done here. The risk is moderate risk, a little more than mild risk. The recommended PP will be N95 mask, goggles, latex examination gloves, and face shield. Then aerosol generating. Then there is pre-anesthetic checkups, clinics, the pre-anesthetic checkup. Moderate risk में है और ये the recommended PPEs are covered. Pharmacy distribution, mild risk, it will come into mild risk. Sanitary staff, again, they frequently touch the floor, so they should have gloves also, latex examination gloves, but triple layer medical mask will be more than enough for them also. Then we have wards, inpatient, for the inpatient ward, individual rooms, or the private rooms you can call them. Again, clinical management is there, mild risk is there, so these mild risk recommended PP should be continued. ICU, the risk is moderate. Then critical care management is being done there in the ICUs. So these PPEs recommended are N95 mask, goggles, latex examination gloves, and face shield. Then in wards and ICU critical care, dead body packing, where these activities being done, the risk is low, so only triple layer medical mask and latex examination gloves will be there. Ward ICU critical care non-COVID areas, the risk is low, so this is there. Emergencies, the attending to emergency cases, mild risk is okay, but the attending to severely ill patients while performing aerosol generating procedures, full complement of PP, this is a high risk area. The full component of PP, that is N95, coverall, goggles, nitrile examination gloves, shoe cover, all these should be are recommended and should be worn. Other supportive areas, ancillary areas, these are the routine lab, the CSSD, the supportive services, including kitchen, etc. The risk is mild and low, more or less. So all these places, the normal recommended PPs are given as per this. Ambulances also, uh, there are when there are SARI patients, the suspected uh, COVID patients, severe acute respiratory infection. The full complement of PP should be there. If you are transferring such patients, then full complement of PP. There we could see these people in ambulances and hospitals. They were having full complement of PPs everywhere, all over. But if we logically think of those places and work, of course, it is good, always good to be more precaution taking, and it was good that we followed those things. But we had so many doctors dying, and the staff nurses and the hospital staff also getting infected with COVID. So it was good that the full complement of PPE and others were taken care of. The important points to remember were the standard precautions to be followed at all times. PPEs are not alternative to basic preventive public health measures such as hand hygiene. That is the most important. Hand hygiene, respiratory etiquettes, which must be followed at all times. Always follow the laid down protocol for disposing of PPEs as detailed in the infection prevention and control guidelines available on website. I could see at many places we can see the coveralls, the full complement of PP, the full coverall being lying in the gardens, in the parks, in the in the corridors, many places, hospitals. I could see in many places where I went. This is not done. We in the hospitals are the persons who should understand this. I'm not saying that only hospital staff would have done it. Maybe some other attendant or somebody has done that, but that should be taken care of immediately. Those things should be taken away from that place. And I could see that it was there, and there was nobody concerned about it. It was just lying, and people were passing through it. So all these things should be taken care. Still, we are not out of danger. We should continue with the precautions. So duties of urban local bodies again. So we have seen these slides. I think these are duplicate slides are coming in. So now this is one of the position control board which has developed for the special poster for the vaccination camps. Now, the vaccination sites are out of the hospital premises. They are mainly coming into camps in the temples, mosques, and other places, and community halls, and also in schools. So many schools have been made the vaccination centers. So these are the posters being put up by Madhya Pradesh Pollution Control Board. They have specially designed these posters and printed them to be put up in all the vaccination centers all over MP. And I'm sure other places would have also done similar things. So this is very important that all this waste should be properly collected from those centers and should be transported back to their centers, the PHCs or the district hospitals or wherever they are coming from. They are definitely connected to some or the other hospital. So they should carry it back to those places from where it should be handed over to the incinerator people. So this is important that this vaccination centers also should be provided this particular information, and this practice should be followed there also. So thank you so much, and I'll be waiting for the questions if there are any.
Thank you, Doctor. Yes, We do have a few questions. Would you like to see the Q&A session, or do you want me to read out, sir?
I am opening it.
Yeah.
As per rules, from my source, somebody has asked, there is no fee charged for biomedical waste authorization. No, sir, there are, the rules say there is some fee, the authorization fee, and that's very nominal. In some states, they are different in different states. This is as per um, the state pollution control boards. It's on their discretion what fees they fix for their state. So in some place where I can tell you is, for first 4 beds, if it is a 10-bedded hospital, we can calculate that easily. First 4 beds, it will be 2,000, and further beds for the rest 6 beds, it will be 200 rupees per year. Per year, 2,000 plus 200, 2,000 for first 4 beds, and 200 rupees in the for the consecutive bed number of beds for each. So multiplied by the balance beds. So that is one of the fee structure in one of the state. Fixed needle syringes, sir. It is clearly said. The next question from Dell. Please clarify disposal of fixed needle syringes. Fixed needle syringes are again cut off before being the needles are separated and put in white, and those the plastic portion goes into the red color. How to overcome the odor due to overcome? You are wearing a mask. So you are pulmonologist. I know your concern will be very high on this, but you're wearing a and biomedical waste generally doesn't have much of odor. Yes, if it is kept for long, then it will be there. A lot of pungent smell and everything will be there. But yes, normally if you are wearing a proper mask, it should not be a problem to you. Presentation should be available on its website. That's for the MedPiper people to understand. Yes, I think Ms. Soumya will be taking care of it. There is some anonymous attendee. How to dispose yellow bin waste where there is no CBWTF and incinerate the groundwater level is less than 6 meters. Sir, less than 6 meters, yes, 6 meters, it is 6 meters is too much. It is actually 2 meters, 6 feet. If it is less than 6 feet, then yes, there is a problem. And you should find some place where at least the half portion, the 3 meter, the 3 feet on 1 meter portion can be underground. And for the top people, you can build a concrete thing. But for under that, below that, it should be the deep burial can be built, can be constructed there also. Dr. Ashok Sharma, lab samples, disposal of lab samples, sir. Disposal of lab samples. See, for liquid waste, you have to have, there is a, as per the biomedical waste rules itself, the bigger hospitals should have ETPs and STPs installed. Very small hospitals and labs cannot do this, but then they can have a small tank attached to their sink below there before releasing the material, your liquid waste to the municipal drain. You should hold that for put a valve before that, and the waste should be collected. The wastewater should go into that, where it can be that you can mix hypochlorite solution up to 2 to 5% or 2% will also do. Minimum 20 minutes it should be held in that particular chamber or the container or any bucket or whatever you can call it. It depends on how big is your waste quantity. So and how much time it takes for the container to fill. You can have 100 liter thing or 20 liter or 10 liter, whatever. That depends on the space available with you. In the small laboratories, there should not be much water waste there. But then, before being drained out to the with the new normal municipal waste, it can be treated. The liquid waste should be treated. The contaminated liquid waste can be treated with 1 to 2% up to 5% of hypochlorite. Minimum 20%, 20 minutes it should be held there and before being released. And in the evening, if you're putting it leaving it in the night, you can even put it for overnight, and in the morning before starting your operations, you can release the decontaminated water into the municipal waste. So I think your answer is there. Method of disposal, blood and urine samples is the same. So difference between red and white category in regard both, it is written fixed needle syringes. 1 second, let me go back to that slide. I'll come back to you. Then, sir, disposal glutaraldehyde. Glutaraldehyde dispose of, you just have to put it again, mix it with the hypochlorite solution for 10 minutes. If it is the glutaraldehyde has been used for disinfecting the things, and then further disinfected before releasing it out. Any more questions? One question is left, which I am going back to that slide and talking to you on that. He is medical officer, PSC Guntur. 1 second, let me go back to that slide. See, syringes with fixed needles from needle tip cutter or burner. So needles, it is not, sorry, it is not the comma. It should be needles from syringes with fixed needles. So you have to cut it with the cutter and then put it there. So it is not the same in this also. It should be without needles. You see fixed needle syringes also without needles. You have to cut it and put it there. Any more questions coming in?
Sir, there is one question in the chat. Like there are like a couple of questions in the chat as well, but I would read the first question. Sir, how to dispose the blood plates from the lab?
Blood plates. 1 second. Come again with the question.
Yeah, how to dispose the blood plates from the lab?
Blood plates means what? The
Not
platelets
sure.
you're talking about?
I think, sir, maybe Mr. Abraham,
The
can you just?
slides, the blood contaminated slides you're talking about.
I think yes.
So those slides are going into this blue color.
Okay.
Either disinfecting it, because see, glassware can be treated with the chemical disinfection can be done on glasses. So those slides can be disinfected with this, and even otherwise also, if you are throwing away the slide and before that you want to wave off the hand, even the gloves, if they are having blood on them, you can go to the sink. See, in OT, in labor room, in your dressing area, and in labs, all these places you need to have the treatment of water, liquid waste coming out from the sink before going into the drain. It should be held at least for 20 minutes or till such time when the container which is being collected, in which the liquid is being collected, gets 3/4 filled. You can collect it till that time. Even if it is more than 20 minutes, let it be with 1 or 2% up to 5% of hypochlorite solution, and then you can release it. So even the blood going into the sink and going to the drain, it will be disinfected before being drained out. And in the bigger hospitals where the ETPs and STPs are there, then you don't have to worry because it is all going through that procedure. In a small setup, 5-10 bedded hospitals, you don't have ETP, you don't in the labs, only laboratories where you don't have any ETPs in small portion is there. So under the your sink, you should put that particular container where you can hold the water before it being drained out to the municipal drain. Any further thing, Ms. Soumya?
Yes, sir. We have two more questions in Q&A. Would you like to
Yeah.
see, or do you want me to read?
I am seeing culture plates. They're talking about culture plates being used in microbiology department. Okay, so this is going into yellow. It's already, you see, it is going into yellow. Microbiology and biotechnology, all these things, the specimens and everything, they are going into yellow color. And what all items? Blue category waste. What all items are covered under blue category? Okay, blue category is glass waste and metallic body implants. These are the main things in going into blue color. So the broken or discarded and decontaminated glass, including medicine vials, ampoules, even this also includes the slides from the labs. So all these things, even the empty bottles of medicine, they have to be thrown out in this. So they have to be disposed of in blue color. Any further thing? I think this all questions are there. Madhya Shanaz, your question was culture plates, so that is going into yellow. Umameshwar from Tamidalapati Sahab, your answer blue category waste also is done. So I think Soumya, all these questions are there. If any more questions are coming in.
I don't think, sir. I think we have
Yeah, these are
answered
the,
all the questions. No?
okay.
Yes.
He's written thank you. So he's got the answer right.
Sir, there is one question in the chat box.
Yeah,
Ms. Aruna have asked, like, can we utilize existing, burial pit for the disposal of waste, or it is must to tie up with the agency for all facilities within 50 meters?
it is important. You cannot do it yourself. These are the rules. It has to be done through them.
Yeah, I had a question. So I just wanted to ask, how long can you use the shield until you have to dispose it?
How long?
How long do you have to use the face shield, the shield that we use, right? Like most of them use in the hospitals, about the face shield that is used. So how long do you have to use it until?
See, if you're not taking it out again and again and not keeping it everywhere, one duty, one shield will be more than enough.
Okay, fine.
If there is any spillage and coming onto it, so then you can change the shield.
Okay, so you can use it for quite a long time, right?
Yeah.
Okay, fine.
Sir, next question from Rita. Sir,
Yes.
is it mandatory to do disinfection of glass waste before sending into CWTF? As of now,
Yes, I am seeing this question.
yeah.
See, mesh buckets have been removed from various hospitals. You see, this question, I also told you that, yes, as per rules, it is written that the disinfection option is given, but it is the State Pollution Control Board which is allowing, most of the state pollution control boards are allowing it directly being sent to the incinerator people. So they will do the disinfection and everything. Okay.
Ms. Sabha have asked, sir, can I use 10% bleach rather than hypochlorite?
10% bleaching powder they are using 10% bleaching powder. So out of that, hypochlorite solution will be made. The bleaching powder also is used to make the powder. Through the powder, it becomes liquid only now. So 10% you can have. See, 2 to 5% is okay, but if it is more than 5%, it will be very difficult for you to your own your own self. It becomes very pungent, and the vapors will start coming in. It will be difficult breathing, and you will have tears in your eyes. So it will be harmful to you only. So let it not be very high. See, initially in 2016, somehow it was written somewhere 10% in the labs. It should be done. 10% hypochlorite solution should be used, but then they reduced it to 1%. So 1 to 2% and maximum up to 5%. See, depending on the blood and the disinfection, you get the sense it is there in your lab or any place. Maximum up to 5%. Don't use more than that. It will become difficult for you. It will be harmful to you itself. See this. How to prevent mixing? Dr. Zahid Ali Khan, your question, how to prevent mixing of general waste with biomedical waste. You have to train your people. You have to train your people, and you have to put very clear indicators that this is biomedical waste. This is not a general waste bin. And those biomedical waste bins should be kept near the nursing station, where the patients in the ward can only throw the biomedical waste only, not the general waste. General waste bins should be kept on the other side, away from the biomedical waste bins. So those are two colors, the green and yellow, green and blue. Let me talk about the general waste, since we are coming up with questions on that. See, there are two colors available all over the city. Everywhere in India, we can see two color of bins for general waste on the streets also, the blue and the green. Somewhere it is written recyclable and biodegradable, but most of the places it is written wet waste and dry waste, gila kachra and suka kachra. So the dry waste means it is recyclable. The wet waste or the gila kachra will mean it is biodegradable. Now, what is gila and what is suka? The recyclable will be all the plastic waste. Paper is recyclable, it can go into this one, the yellow waste also, the green one. If you see a plastic glass with some half filled with tea, what will you call it? You will call it the wet waste. No, it is not a wet waste. It is recyclable waste, because it's the plastic. The wet portion will evaporate in some time, will dry off. But the thing that will be left, the waste that will be left, will be the hard plastic, the solid plastic. That has to be taken care of. So that is recyclable, and that will go into blue. So this is what we have to understand. Okay, I'm sure you have understood this question, Dr. Zahid Ali. Please confirm that you have understood. And Mr. Umameshwar, yes, biomedical waste comes under the Environment Act, EP Act, the Environment Protection Act. So not CP, I don't know what you're talking about, but EP Act it is known as Environment Protection Act. Dr. Rashmi Thakuria, what percentage of hypochlorite used for large bodies fluid spills? See, maximum up to 5%, nothing more than that. It will be harmful to you. Consumer Protection Act, Consumer Protection covers many things. Yes, Consumer Protection Act is different. You can, if somebody is not doing it properly, then Consumer Protection Act will Can be definitely yes. Yes, Consumer Protection Act will be there. EP Act, EP, the Environment Protection Act. So under Environment Protection Act only, it is there. These rules are there. Set of rules are there only. And then Dr. Vandana, how about needles used in houses? How to dispose them, ma'am? I told you how home biomedical waste, the house generated biomedical waste, because many old age people and many patients are getting treated at home. So it's the duty of the treating doctor to educate the attendants how to dispose the needles used in the houses. Needles only means the injection needles. I'm not talking about the swing needles. Huh? So those needles should be boiled for some time before being thrown out, or if they can be separately given in a container to so then it can be it can save for getting the needle stick injury. Somebody can be saved because of that. So you can store it in a hard plastic thing and then give it to the vendor who is taking the waste from collecting the waste from you. So that is again another point. So Ms. Vandana, I think I've cleared your point also. Any further things? I think all the questions are there. Anything you please ask. You have time, no problems.
Sir, in chat, Mr. Abraham Thomas have asked about blood agar plates have two components, plastic plates and agar. Can you kindly explain how they are discarded?
See, the plastic portion will go into red. And if it is joint, where is this question? I can't see this question.
Sir, in chat. In chat.
Yeah, I'm in chat. Okay. I can't see this. See, if there are two separate things, the plastic and the glass thing, the glass will go into the blue and plastic will go into red. I'm not able to understand the question otherwise. Chat section, I'm not able to see the chat section.
Or else I'll do one thing, sir. I can ask Mr. Abraham to write a detailed email about it, and I can.
Yeah. Please ask
That
him.
works.
Please ask him. We'll answer him.
Yeah, sure.
Any further questions? Any more questions in the chat section? Because chat section is not. I can't see the chat section here. I only have the question answer portion. I'm looking into that.
Sir, I think we have answered all the questions. Maybe attendees, if there is any more questions, please put in Q&A session so that Farid sir can answer it well.
Yeah, please. I can see the. Okay, they're asking about the PPT.
PPT, yeah, that maybe we can give once the webinar is done, and we shall discuss like what all can be shared with the attendees that we can share with the.
Okay. And if this is recorded, the recording will be there. So the entire presentation will be there on the record.
Yes.
Right?
Yes, sir. Yeah.
So I think they can see it, or your take. You can do it as you want.
Okay, sir. So I think maybe we have answered all the questions now, and maybe if there are any more questions, you can send it to me,
please.
Soumya@medpiper.com. I shall forward to Farid sir. so that the queries can be answered accordingly. And once again, thank you so much, Farid sir, for joining us today on a Friday afternoon till evening, being a busy day and all. And I think the session was really, informative, and also like each area you have explained so well. Even a person who doesn't understand more about the biomedical waste management also, can understand how we can segregate the waste properly. And moreover, I would like to thank all the attendees who have joined today and patiently, listening to us. Then I would like to thank all the MedPiper and Jonamed team, being present today to help us, in working out the entire session. Thank you so much. So the webinar recording, the participation certificates will be, sent out to all the attendees in few days. Thank you so much.
Thank you, Ms. Soumya, and thank you, MedPiper, for this opportunity. And thank you all the participants for attending and listening to me and your questions also, because there are many queries which go unanswered many times. So even a small thing will keep on disturbing you. It's good that you keep asking, and if still there is something, like Ms. Soumya has said, please ask her, you send your queries to her, and they'll come to me, I'll answer your queries. Thank you so much.